Being in an altered state of mind can definitely be scary, but imagine not being in control or aware of this at the same time. This is exactly what a person with dissociative identity disorder deals with daily. Dissociative identity disorder is also known as multiple personality disorder. This disorder is a mental illness that involves disruptions or breakdowns of mental functions that normally work smoothly. For example, memory, consciousness or awareness, identity, and perception. First, I will inform you on how DID is diagnosed. Then we will discuss the causes and symptoms of DID, and finally how a person with DID is treated. Learning about dissociative identity disorder is important because although it is very rare, there are people who are affected by this mental illness, and it is important to be aware of the symptoms and behavior. If there is a chance that you or a loved one is suffering from an unidentified mental illness, it is important to get immediate help. While looking at an article by the Cleveland Clinic, it states if no physical illness is found, the person might be referred to a mental health professional, such as a psychiatrist or psychologist who specializes in treating and diagnosing mental illnesses. This is the first step towards a diagnosis in which will help you identify and come to terms with your mental illness. There is a specific process for diagnosing a dissociative disorder. According to the Cleveland Clinic, they also claim they will perform a clinical interview to get a full picture of a person's past experiences and current functioning. Some psychiatrists and psychologists may employ specialized testing or a standard interview such as a structural clinical interview for dissociation. And these tests are extremely critical when diagnosing such disorders because usually more than often these are lifelong conditions that require the proper treatment to prevent patient from hurting themselves or other people. Before looking at treatments, one must first understand the causes and symptoms of dissociative identity disorder. Many people might not be aware that past traumas can potentially affect them in the future by bringing forth a mental illness that was not previously diagnosed. In the article Dissociative Identity Disorder by American Association for Marriage and Families, they reveal that the main cause of DID is believed to be severe and prolonged trauma experienced during childhood, including emotional, physical, and sexual abuse. People with DID usually start to develop this condition as a coping mechanism to lose touch with reality and cope with their past traumas. There are tons of symptoms that can arise within a person due to the diagnosed disorder. According to the American Association for Marriage and Families, they proclaim many symptoms of DID are similar to those of other physical and mental disorders, such as substance abuse, seizure disorders, and post-traumatic stress disorders. Some symptoms include the inability to remember large portions of their childhood, frequent memory loss, hallucinations, suicidal attempts, and changing levels of functioning from highly effective to nearly disabled. Treating this mental illness can be tricky due to the fact that there's no cure for dissociative identity disorder. There are only treatments to help the severity of the illness. Some treatments can help alleviate the symptoms that come with the tragic mental illness, and that includes psychotherapy. As reported by the Mayo Clinic, they claim that psychotherapy is the primary treatment for dissociative disorders. Over time, your therapist may help talk you more about the trauma you've experienced, and psychotherapy is one of the main treatments that will help an individual deal and cope with this mental illness. It involves pretty much talking about the disorder and other issues due to the illness with a trained professional. This trained professional can also authorize other treatments such as medications to help with some symptoms. For instance, according to the Mayo Clinic, they state, although there are no medications that specifically treat dissociative disorders, your doctor can prescribe antidepressants, anti-anxiety medications, or antipsychotic drugs to help control the mental health symptoms associated with dissociative disorders. These medications that can be potentially prescribed to an individual with dissociative identity disorder does not exactly treat the disorder itself, but the symptoms that arise with it. For example, it can help to treat depression, anxiety, etc. To conclude, dissociative identity disorder can be extremely scary to deal with, either personally or through a loved one. This disease also allows a person to lose touch with reality and cope by creating other personas to deal with their past trauma. This disorder does not allow for an individual to function properly, mentally speaking. To review, I previously mentioned how DID is diagnosed, the causes and symptoms of DID, and the treatment of this illness. Again, put yourself in the shoes of an individual who has been diagnosed with dissociative identity disorder, and imagine how terrifying it would be to be in an altered state of mind and have absolutely no control or awareness of it. Thank you.